Question 1. A social worker in private practice receives a subpoena for a client's records from the client's spouse, who is involved in a contentious divorce proceeding. The client has not provided consent for the release of information. What is the first action the social worker should take? A. Immediately release the records to comply with the subpoena and avoid legal repercussions. B. Contact the client to inform them of the subpoena and discuss their preferences for responding. C. Contact the spouse's attorney to assert privilege and refuse to release the records. D. Seek legal counsel to determine the validity of the subpoena and the best course of action. Answer: B. Contact the client to inform them of the subpoena and discuss their preferences for responding. This question tests the social worker's ethical responsibility regarding client confidentiality and legal demands. The crucial first step when receiving a subpoena for client records without explicit client consent is to notify the client, as their right to confidentiality is paramount. This allows the client to understand the situation, consult their own attorney, and decide how they wish to proceed, such as by asserting privilege or consenting to the release. For example, the client may want to challenge the subpoena or might decide it's in their best interest to release specific information. Always empower your client to make informed decisions about their protected health information before taking any other action. Question 2. A social worker is providing individual therapy to an adult client who reveals during a session that they have recently started an intimate relationship with a former client who terminated services 6 months ago. The social worker had a positive therapeutic relationship with the former client. What is the most appropriate action for the current social worker to take? A. Encourage the client to continue the relationship if they both seem happy and healthy. B. Terminate services with the current client due to the conflict of interest. C. Discuss the ethical implications of dual relationships and the potential for harm with the client. D. Report the former client to the state licensing board for engaging in an unethical relationship. Answer: C. Discuss the ethical implications of dual relationships and the potential for harm with the client. This question addresses the complex ethical issue of dual relationships and the social worker's responsibility to protect clients from harm. While the relationship is between the client and a former client of the social worker, not the social worker themselves, it still creates a significant ethical dilemma and potential conflict of interest. The most appropriate first step is to discuss the ethical guidelines and potential risks of such a relationship with the current client, explaining why engaging in relationships with former clients can be problematic due to power imbalances and the nature of the therapeutic bond. This helps the client understand the potential for exploitation or harm, aligning with the principle of client self-determination and protection. For instance, the social worker might explore how the former therapeutic relationship could influence the current romantic one. Your primary duty is to ensure your current client is informed and protected from any potential harm arising from this situation. Question 3. A social worker is conducting an initial assessment with a client who discloses feeling hopeless and mentions having a detailed plan for suicide, including access to means, but expresses ambivalence about acting on it. What is the social worker's best first step? A. Explore the client's reasons for living and identify their support system. B. Complete a comprehensive suicide risk assessment and develop a safety plan with the client. C. Contact the client's emergency contact to inform them of the suicide risk. D. Refer the client immediately to an inpatient psychiatric facility. Answer: B. Complete a comprehensive suicide risk assessment and develop a safety plan with the client. This question tests the social worker's ethical and clinical responsibility when a client expresses suicidal ideation with a plan. The best first step is to conduct a thorough suicide risk assessment to gauge the immediate danger and then collaboratively develop a safety plan with the client. This includes identifying coping strategies, triggers, and resources, and removing access to means if possible. For example, This might involve the client agreeing to call a crisis line or a trusted friend if urges intensify. While exploring reasons for living and considering higher levels of care are important, they follow the initial, critical step of assessing risk and establishing immediate safety measures. Question 4. A social worker providing services to an undocumented immigrant family learns that the parents are working in unsafe conditions and are afraid to report it due to their immigration status. The parents express fear of deportation if any information is shared. What is the most ethical course of action for the social worker? A. Advise the family to immediately report the unsafe conditions to authorities. B. Respect the family's wishes regarding reporting and explore alternative ways to ensure their safety and well-being. C. Document the unsafe conditions and anonymously report them to the relevant labor authorities. D. Contact an immigration attorney to discuss the family's legal options before proceeding. Answer: B. Respect the family's wishes regarding reporting and explore alternative ways to ensure their safety and well-being. This question highlights the ethical principles of self-determination, cultural competence, and the duty to do no harm, particularly with vulnerable populations. While advocating for safe working conditions is important, the most ethical course of action is to prioritize the family's expressed fears and concerns about deportation, respecting their autonomy. The social worker should explore options with the family that align with their goals and safety, such as connecting them with advocacy organizations that specialize in undocumented workers' rights without requiring direct reporting, or exploring community resources. For example, the social worker might research local organizations that offer legal aid or support for workers in similar situations, providing information without pressuring the family to act. Always prioritize the client's safety and self-determination, especially when their situation involves significant risks. Question 5. A social worker is supervising an intern who is struggling with maintaining appropriate professional boundaries with a client, frequently engaging in casual conversation unrelated to treatment goals during sessions and accepting small, homemade gifts. What is the first action the social worker supervisor should take? A. Terminate the intern's supervision and report their unethical behavior to their academic program. B. Directly intervene in the intern's client sessions to model appropriate boundary setting. C. Provide direct, constructive feedback to the intern regarding boundary issues and reinforce ethical guidelines. D. Require the intern to review the NASW Code of Ethics and write a reflection paper on professional boundaries. Answer: C. Provide direct, constructive feedback to the intern regarding boundary issues and reinforce ethical guidelines. This question focuses on the ethical responsibilities of a social work supervisor in guiding and educating interns. When an intern displays boundary issues, the first and most appropriate step for the supervisor is to address the behavior directly and constructively. This involves providing specific feedback, explaining the rationale behind ethical boundaries, and reviewing professional expectations. For instance, the supervisor could explain how casual conversation can blur roles and how accepting gifts, even small ones, can create a sense of obligation or alter the therapeutic relationship. This educational approach aims to remediate the intern's practice and support their professional development, which is a core duty of supervision. Question 6. A social worker is working with a child client whose parents are divorced and share joint legal custody. The non-custodial parent, who pays for therapy, requests regular detailed updates on the child's progress and the content of sessions. The custodial parent has only given consent for the social worker to communicate with them about treatment. What is the social worker's most ethical action? A. Provide regular updates to the non-custodial parent, as they are paying for the services. B. Decline to provide detailed updates to the non-custodial parent without explicit consent from both parents or a court order. C. Provide general, non-confidential updates to both parents, avoiding specific session content. D. Inform the non-custodial parent that all communication must go through the custodial parent. Answer B. Decline to provide detailed updates to the non-custodial parent without explicit consent from both parents or a court order. This question addresses the ethical obligations of confidentiality and informed consent, particularly when working with minors and divorced parents. The social worker's primary responsibility is to maintain the child's confidentiality and adhere to the consent provided by the custodial parent. Without explicit consent from both parents for information sharing or a specific court order mandating it, the social worker cannot disclose confidential session details. For example, the social worker should explain to the non-custodial parent that ethical guidelines and the need to protect the child's privacy prevent sharing detailed information without proper consent. Always prioritize protecting the client's confidentiality and ensuring all necessary consents are in place before sharing information. Question 7. A social worker in a community mental health agency discovers that a colleague is consistently coming to work late, missing appointments, and frequently appears disoriented. Other staff members have noticed these behaviors. What is the first action the social worker should take? A. Report the colleague to the state licensing board immediately. B. Discuss concerns with a supervisor or agency administrator to explore potential impairment. C. Confront the colleague directly about their behavior and express concerns. D. Offer to cover the colleague's missed appointments to help manage their caseload. Answer B. Discuss concerns with a supervisor or agency administrator to explore potential impairment. This question tests the social worker's ethical responsibility when observing a colleague's potential impairment, which can affect client care and the agency's reputation. The first and most appropriate step is to discuss these observations with a supervisor or agency administrator. This approach allows for an objective assessment of the situation, protects client safety, and ensures the matter is handled through appropriate agency channels, which may include offering support to the colleague or initiating formal intervention. For example, a supervisor can investigate the observations and determine if the colleague needs professional help or if workplace accommodations are necessary. Always follow agency protocols and involve those in authority when concerns about a colleague's competence or impairment arise. Question 8. A social worker receives a friend request on a personal social media account from a current client. The social worker has a strict policy against connecting with clients on social media. What is the best way for the social worker to handle this situation? A. Ignore the friend request and say nothing to the client. B. Accept the request, but make sure all privacy settings are very strict. C. Decline the request and explain the professional boundaries to the client in the next session. D. Send a private message to the client explaining why the request cannot be accepted. Answer C. Decline the request and explain the professional boundaries to the client in the next session. This question addresses the ethical challenge of maintaining professional boundaries in the age of social media. The best approach is to respectfully decline the friend request and then, in the safety of the therapeutic relationship, discuss the reasoning behind the professional boundary. This allows for an educational moment where the social worker can explain how maintaining separate professional and personal lives protects the therapeutic space and client confidentiality, without causing the client to feel rejected or personally singled out. For instance, the social worker might say, "I received your friend request, and I want to explain that my policy is to maintain professional boundaries to ensure our therapy remains focused on your goals." Always use a direct and open approach to clarify boundaries, which fosters trust and reinforces the therapeutic framework. Question 9. A client receiving long-term therapy informs their social worker that they plan to move to another state in 2 weeks and will need to terminate services. The client expresses anxiety about finding a new therapist quickly. What is the social worker's most ethical next step? A. Extend therapy for a few extra weeks to help the client manage their anxiety. B. immediately provide the client with a list of therapists in their new location. C. Begin a termination process that includes discussing the client's feelings about ending therapy and assisting with referrals. D. Suggest that the client consider teletherapy to continue working with the current social worker. Answer: C. Begin a termination process that includes discussing the client's feelings about ending therapy and assisting with referrals. This question focuses on the ethical process of client termination, emphasizing the social worker's responsibility to manage the transition responsibly. When a client initiates termination, the most ethical next step is to engage in a structured termination process. This involves openly discussing the client's feelings about ending the therapeutic relationship, processing the therapeutic work accomplished, and actively assisting the client in finding appropriate referrals for continued care in their new location. For example, the social worker might explore the client's past experiences with goodbyes and collaboratively research potential new providers, ensuring a smooth transition. Responsible termination is crucial to prevent client abandonment and ensure continuity of care. Question 10. A social worker providing services in a rural area receives a request from a client to provide therapy to their adult child, who lives in the same small community. The social worker is the only mental health professional in the area with expertise in the adult-child specific issue. What is the first ethical consideration for the social worker? A. The potential for a dual relationship or conflict of interest with the existing client. B. The social worker's competence to treat the adult-child specific issue. C. The adult child's right to access mental health services. D. The social worker's ability to maintain confidentiality for both clients in a small community. Answer: A. The potential for a dual relationship or conflict of interest with the existing client. This question tests the social worker's awareness of complex ethical considerations, particularly in rural settings where resources are limited. The first ethical consideration is the potential for a dual relationship or conflict of interest that arises from treating two individuals connected in this way, even if indirectly. While the need for services is high, the social worker must assess how treating the adult child could impact the therapeutic relationship with the parent, compromise objectivity, or affect confidentiality for both. For example, knowing details about the adult child's life could inadvertently influence the social worker's perception of the parent, or vice versa. Always prioritize identifying and mitigating potential conflicts of interest to maintain professional boundaries and effective client care. Question 11. A social worker is facilitating a support group where one member consistently dominates the discussion, interrupts others, and offers unsolicited advice that is often unhelpful or judgmental. Other group members appear increasingly uncomfortable and disengaged. What is the best action for the social worker to take? A. Ask the dominating member to leave the group permanently. B. Gently interrupt the dominating member and redirect the discussion to ensure all members can participate. C. Privately speak with the dominating member after the session to address their behavior. D. Allow the group dynamics to play out, hoping other members will confront the behavior. Answer: B. Gently interrupt the dominating member and redirect the discussion to ensure all members can participate. This question assesses the social worker's skill in managing group dynamics ethically and effectively. The best action is to directly, yet gently, intervene in the moment to manage the dominating member's behavior and create a safe and equitable space for all participants. This involves using facilitative skills to redirect the conversation, establish group norms, and empower other members to speak. For example, the social worker might say, "Thank you for sharing, member's name, let's hear from others now," or "It's important that everyone has a chance to speak." This approach addresses the immediate problem without shaming the individual and reinforces the principles of respectful group interaction. Question 12. A social worker employed by a school district is working with a student whose parents are in the process of a bitter divorce. Both parents repeatedly call the social worker, attempting to gain information about the other parent's actions or to use the social worker to advocate for their position in court. What is the most appropriate response from the social worker? A. Inform both parents that the social worker's role is solely to support the student's well-being and cannot be used in divorce proceedings. B. Document all parental contacts and share them equally with both attorneys involved in the divorce. C. Refer both parents to a family therapist specializing in high-conflict divorce. D. Agree to provide a written report to the court detailing the student's emotional state, but only if both parents consent. Answer: A. Inform both parents that the social worker's role is solely to support the student's well-being and cannot be used in divorce proceedings. This question tests the social worker's ability to maintain professional boundaries and uphold the ethical principle of client-focused practice, especially when caught in parental conflict. The most appropriate response is to clearly define the social worker's role and boundaries to both parents, emphasizing that the focus is on the student's well-being and not on the parent's legal dispute. This helps prevent the social worker from being triangulated into the divorce proceedings and protects the therapeutic relationship with the student. For example, the social worker might explain, "My role is to support your child within the school setting, and I cannot share information or participate in legal matters related to your divorce." Always prioritize your direct client's needs and maintain clear professional boundaries to avoid conflicts of interest. Question 13. A social worker provides individual therapy to a client who discloses during a session that they are currently experiencing significant financial hardship and cannot afford groceries. The client asks the social worker for a small loan until their next paycheck. What is the social worker's best response? A. Provide the client with a small loan, as refusing would be unethical given the client's immediate need. B. Offer to purchase groceries for the client to address their immediate need, as a one-time gesture. C. Explain that providing a loan would create a dual relationship and explore community resources for financial assistance and food. D. Terminate therapy with the client due to the client's request, creating a boundary violation. Answer: C. Explain that providing a loan would create a dual relationship and explore community resources for financial assistance and food. This question probes the ethical boundaries surrounding financial interactions and dual relationships in social work. The best response is to uphold professional boundaries by explaining why providing a loan is inappropriate. It creates a dual relationship that could compromise the therapeutic process, while simultaneously addressing the client's immediate need by connecting them with appropriate community resources. For example, the social worker might say, "While I cannot provide financial assistance, I can help you find local food banks, temporary aid programs, or emergency housing resources." This approach demonstrates care and responsiveness without compromising professional ethics. Always seek to meet client needs through ethically sound and appropriate channels, avoiding any blurring of professional roles. Question 14. A social worker in a hospital setting is discharging an elderly client who lives alone and has no known family or support system. The client requires significant follow-up care for a chronic medical condition. What is the social worker's primary ethical obligation? A. To ensure the client has a safe discharge plan that includes access to necessary follow-up care. B. To respect the client's right to self-determination, even if it means discharging them without a comprehensive plan. C. To contact adult protective services due to the client's vulnerability. D. To involve law enforcement if the client refuses recommended care, citing potential self-neglect. Answer: A. To ensure the client has a safe discharge plan that includes access to necessary follow-up care. This question focuses on the social worker's ethical responsibility for client safety and continuity of care, especially for vulnerable populations. The primary ethical obligation in a hospital discharge setting, particularly for a client with no support system and ongoing needs, is to ensure a safe and comprehensive discharge plan. This plan should address their medical, social, and practical needs, including referrals for follow-up care, home health, and community resources, while still respecting their autonomy to the greatest extent possible. For example, the social worker might coordinate with home health agencies, meal delivery services, and medical equipment providers to ensure a smooth transition and continued well-being. Always prioritize creating a discharge plan that actively supports the client's safety and well-being post-hospitalization. Question 15. A social worker is leading a therapy group for survivors of domestic violence. One group member, in a fit of anger, makes a veiled threat against their abusive ex-partner, stating, he's going to get what's coming to him soon, one way or another. The social worker assesses a potential for harm, but the threat is not direct or specific. What is the next best action for the social worker? A. Document the statement and monitor the client for further threats. B. Immediately break confidentiality and warn the ex-partner and law enforcement. C. Assess the client's intent and specific plan for harm more thoroughly, and review confidentiality limits with the client. D. Terminate the client from the group due to safety concerns. Answer: C. Assess the client's intent and specific plan for harm more thoroughly, and review confidentiality limits with the client. This question tests the social worker's ethical responsibility regarding the duty to warn and protect, requiring careful assessment. When a client makes a veiled threat, the next best action is to thoroughly assess the client's intent, specific plan, and immediate risk. This involves asking clarifying questions to determine if a clear and present danger exists, and simultaneously reminding the client about the limits of confidentiality in cases of expressed intent to harm. For example, the social worker might ask, "Can you tell me more about what you mean by what's coming to him?" This approach balances the client's right to confidentiality with the ethical obligation to protect potential victims. Question 16. A social worker is facilitating a parenting workshop when a participant, visibly upset, approaches the social worker during a break and confides that they are experiencing severe marital problems and are considering divorce. The participant asks the social worker for a private session to discuss their marital issues further. What is the most ethical response from the social worker? A. Agree to meet for a private session, as the participant is clearly in distress. B. Gently explain that, as the workshop facilitator, providing individual therapy to a participant would constitute a boundary violation and offer a referral. C. Suggest the participant talk with other workshop attendees for support regarding marital issues. D. Decline to offer any further assistance, as the workshop is the only service provided. Answer: B. Gently explain that, as the workshop facilitator, providing individual therapy to a participant would constitute a boundary violation and offer a referral. This question addresses the ethical principle of maintaining clear professional boundaries and avoiding dual relationships. The most ethical response is to kindly decline the request for individual therapy, explaining that serving in both roles, workshop facilitator and individual therapist, would create a boundary violation and a conflict of interest. The social worker should then offer appropriate referrals for individual or couples counseling. For example, the social worker might say, "I appreciate you sharing your concerns, and I want to ensure you get the best support. My role in this workshop is distinct from individual therapy, but I can provide you with referrals to qualified therapists who specialize in marital counseling." Always maintain clear professional roles to protect both the client and the integrity of the therapeutic relationship. Question 17. A social worker receives a gift from a client at the termination of a successful long-term therapy. The gift is a moderately expensive, handmade piece of jewelry that the client states is a token of deep appreciation. The social worker feels genuinely touched. What is the most ethical action for the social worker to take? A. Graciously accept the gift, as it is a small token given at termination and appears culturally appropriate. B. Decline the gift, explaining that ethical guidelines prevent social workers from accepting gifts of monetary value. C. Accept the gift, but immediately donate it to a charity to avoid any appearance of impropriety. D. Discuss the meaning of the gift with the client and, based on that discussion, decide whether to accept or decline, documenting the decision. Answer: D. Discuss the meaning of the gift with the client and, based on that discussion, decide whether to accept or decline, documenting the decision. This question presents a nuanced ethical dilemma regarding gift giving, particularly at termination. The most ethical action is to engage in a discussion with the client about the meaning of the gift. This allows the social worker to understand the client's intentions, assess any potential for coercion or boundary crossing, and then make an informed decision, documenting the rationale. For example, the social worker might explore if the gift is a genuine expression of gratitude, a means to continue the relationship, or if the client views it as payment. This approach respects the client's gesture while upholding professional integrity and provides an opportunity to process the ending of the therapeutic relationship. Question 18. A social worker in a community mental health clinic is informed by a client that their previous therapist at a different agency engaged in what sounds like a clear boundary violation, e.g., meeting outside of sessions for coffee, revealing personal details. The client is hesitant to report it. What is the social worker's ethical responsibility? A. Encourage the client to report the former therapist to the licensing board, offering to assist them. B. Focus solely on the current client's treatment needs and avoid involvement in past therapist issues. C. Inform the client of their rights and options regarding reporting ethical violations, without pressuring them to act. D. Report the former therapist to the licensing board anonymously on behalf of the client. Answer: C. Inform the client of their rights and options regarding reporting ethical violations, without pressuring them to act. This question addresses the social worker's ethical responsibility when a client discloses past unethical treatment. The social worker's ethical duty is to prioritize the current client's autonomy and well-being. Therefore, the ethical responsibility is to inform the client of their rights regarding reporting ethical violations and the available avenues for doing so, while ensuring the client feels empowered to make their own decision without pressure. For example, the social worker might provide information about the state licensing board's complaint process and explain the client's right to pursue or not pursue a complaint. Always empower clients with information and respect their self-determination, even in sensitive situations. Question 19. A social worker is providing telehealth services to a client who lives in a different state. During a session, the client expresses a desire for face-to-face sessions as their mental health is deteriorating, but they cannot travel. The social worker's license is not valid in the client's state. What is the social worker's most ethical course of action? A. Continue telehealth sessions, as the client needs consistency, and advocate for reciprocal licensing. B. Inform the client of the licensing limitations and refer them to a qualified social worker in their state of residence. C. Advise the client to travel to the social worker's state for face-to-face sessions. D. Contact the client's state licensing board to request a temporary license to continue services. Answer: B. Inform the client of the licensing limitations and refer them to a qualified social worker in their state of residence. This question addresses the ethical and legal complexities of providing telehealth services across state lines, particularly concerning licensure. The most ethical course of action is to immediately inform the client about the social worker's licensing limitations and the legal inability to provide services in the client's state. The social worker must then facilitate a responsible termination and provide appropriate referrals to a licensed and qualified professional in the client's state of residence. For example, The social worker might help the client identify local mental health agencies or individual practitioners in their area. Always adhere to licensing laws to ensure legal and ethical practice, prioritizing the client's access to appropriate care. Question 20. A social worker is conducting an intake assessment with a new client who appears to be under the influence of alcohol. The client is coherent enough to provide basic information but struggles to focus and fully understand the intake forms, including the informed consent for treatment. What is the social worker's most appropriate first action? A. Proceed with the intake, focusing on building rapport and gathering only essential information. B. Reschedule the intake session for another day when the client is sober, explaining the need for informed consent. C. Ask the client to sign the informed consent form, assuming they can understand it well enough. D. Contact the client's emergency contact to inform them of the client's current state. Answer. B. Reschedule the intake session for another day when the client is sober, explaining the need for informed consent. This question tests the social worker's understanding of informed consent and client capacity. The most appropriate first action is to reschedule the intake session, clearly explaining to the client that it's crucial for them to be fully present and capable of understanding and providing informed consent for treatment. Informed consent requires that a client is competent to make decisions, understands the information, and provides consent voluntarily. For example, the social worker might say, "I want to ensure you fully understand everything we discuss and agree to today, so it would be best to reschedule for a time when you feel more clear-headed." Always prioritize ensuring clients have the capacity to provide true informed consent before beginning services. Question 21. A social worker is asked by a local newspaper to comment on a high-profile criminal case involving a former client, whom the social worker had seen for a brief period 10 years ago. The social worker believes that insight into the client's past could help explain their current behavior. What is the social worker's most ethical response? A. Grant the interview, but only discuss general psychological principles relevant to the case, without naming the client. B. Decline the interview, citing client confidentiality, even though the client is former and the contact was brief. C. Contact the former client to obtain consent for the interview, explaining the potential benefits. D. Agree to the interview, but disguise any identifying details about the client to protect their privacy. Answer. B. Decline the interview, citing client confidentiality, even though the client is former and the contact was brief. This question focuses on the enduring ethical principle of client confidentiality, even concerning former clients. The most ethical response is to unequivocally decline the interview. A social worker's duty of confidentiality extends indefinitely beyond the termination of services, and even confirming that someone was a client, or offering generalized insights that could be linked to them, constitutes a breach. For example, even if the client's name is publicly known, discussing any aspect of their past treatment history with a social worker is a violation. Always protect client confidentiality, as it is a cornerstone of the social work profession and client trust. Question 22. A social worker in a child welfare agency is investigating a report of child neglect. During a home visit, the social worker observes conditions that strongly suggest the primary caregiver is abusing illicit substances, though the report did not mention substance abuse. The children appear adequately cared for at the moment. What is the social worker's next most appropriate step? A. Immediately contact law enforcement to report suspected drug activity. B. Focus solely on the original neglect report and document observations about substance use for future reference. C. Incorporate concerns about substance abuse into the ongoing assessment of child safety and well-being. D. Confront the caregiver directly about the suspected substance abuse, demanding an explanation. Answer. C. incorporate concerns about substance abuse into the ongoing assessment of child safety and well-being. This question tests the social worker's ability to conduct a comprehensive assessment and prioritize child safety when new concerns arise during an investigation. The next most appropriate step is to integrate the observations of suspected substance abuse into the broader assessment of child safety and well-being. Substance abuse, even if not directly leading to current neglect, is a risk factor that needs to be explored for its potential impact on the caregiver's ability to provide consistent care. For example, the social worker might subtly observe interactions, ask about daily routines, or look for other signs of impairment as part of the holistic assessment. Always broaden your assessment to include any relevant factors that could impact a child's safety and well-being. Question 23. A social worker is creating a new website for their private practice. They are considering including client testimonials to attract new clients. What is the most ethical guideline the social worker should consider regarding testimonials? A. Testimonials are acceptable if they are anonymous and do not reveal any identifying client information. B. Testimonials are only acceptable if the client offers them unsolicited and provides written consent for their use. C. Social workers should avoid soliciting or using testimonials from current or former clients due to the potential for coercion and confidentiality breaches. D. Testimonials are ethical as long as the social worker clearly states that results may vary. Answer: C. Social workers should avoid soliciting or using testimonials from current or former clients due to the potential for coercion and confidentiality breaches. This question addresses the ethical standards regarding advertising and client testimonials in social work practice. The most ethical guideline dictates that social workers should generally avoid soliciting or using testimonials from current or former clients. This is because there is always a potential for coercion, exploitation, or undue influence, given the power imbalance inherent in the therapeutic relationship. Even anonymous testimonials can inadvertently breach confidentiality or compromise the integrity of the professional relationship. For example, a client might feel pressured to provide a positive review to please their therapist. Always prioritize protecting clients from potential exploitation and upholding the integrity of the profession over marketing strategies. Question 24. A social worker discovers that their agency's electronic client record system has been compromised, and client data might have been accessed by unauthorized individuals. What is the first action the social worker should advocate for or take? A. Notify all clients immediately about the potential data breach. B. Secure the system, assess the extent of the breach, and follow established agency protocols for data security incidents. C. Contact law enforcement to report a cybercrime. D. Delete all affected client data to prevent further unauthorized access. Answer: B. Secure the system, assess the extent of the breach, and follow established agency protocols for data security incidents. This question tests the social worker's ethical and practical responsibility in responding to a data breach, emphasizing immediate protective measures and adherence to protocols. The first action is to secure the system to prevent further compromise, then immediately assess the extent and nature of the breach, and meticulously follow the agency's established protocols for data security incidents. These protocols typically outline steps for containment, investigation, notification requirements, and remediation, ensuring a systematic and compliant response. For example, this might involve isolating affected servers and working with IT specialists. Always prioritize containing the breach and following proper procedures before considering client notification, which is usually a later step guided by regulations like HIPAA. Question 25. A social worker is working with an adolescent client who, through artwork and journaling, expresses intense feelings of anger towards a parent and frequently fantasizes about running away from home. The client has not made any direct threats to self or others and appears to be using therapy to process these feelings. What is the most ethical approach for the social worker? A. Discuss the client's feelings with the parent immediately, as the parent has a right to know. B. Focus on validating the client's feelings and exploring the underlying issues contributing to their anger and desire to run away. C. Report the client to Child Protective Services for expressing thoughts of running away, indicating potential neglect. D. Suggest that the client consider medication to help manage their intense anger. Answer: B. Focus on validating the client's feelings and exploring the underlying issues contributing to their anger and desire to run away. This question tests the social worker's ethical approach to working with adolescents, emphasizing the importance of therapeutic engagement and self-determination within limits. When an adolescent expresses intense feelings or fantasies of escape without direct threats or immediate danger, the most ethical approach is to validate their feelings and explore the underlying causes within the therapeutic relationship. This respects the client's processing style and allows for deeper therapeutic work, fostering trust and insight. For example, the social worker might explore what life would be like if they ran away or what changes they wish to see at home. Always prioritize creating a safe space for the client to explore their emotions and experiences, which builds rapport and facilitates genuine change.